Tonight we're talking about COVID-19 and the impact on Canberra's social fabric. How has COVID and the response to it changed how we live and interact socially? And also, how could the community be affected in the next few years? In a moment, we're going to hear from some of our panelists. But while others join us, let's have a little bit of small talk as people are joining this forum. Yonatan, first to you. Tell us a little bit about your day, what you've been up to today. And Yonatan, you'll just need to unmute yourself. Yeah.
Thanks, Adrienne. I have had a very busy day. I was teaching and had taught in several Zoom meetings, and preparing some slides for my speech tonight.
And Emma, by the looks of it, you had a post-budget event here in Canberra. You'll need to unmute yourself as well.
That's right, Adrienne. So ACTCOSS hosted our post-ACT budget forum for our members in the community sector, where we invited key ministers to be and invited questions from our members about the budget, things that we were very pleased to see, and to ask some questions where we saw gaps and future opportunities for investment. So it's been a big day, but really excited to be here this evening.
Also joining us tonight, Darlene Cox from the Healthcare Consumers Association. Great to see you, Darlene. You'll need to unmute yourself. What was your day like?
Yeah, pretty full day. My days start very early with COVID-related meetings, and then I got to join the ACTCOSS budget forum, which was terrific. It's great that we have such amazing access to ministers and be able to ask them the questions, and we're very fortunate in that they don't get defensive. They just want to have a chat to us and explain the agenda and some of the rationale around their spending decisions. So terrific, and finished with some cuddles with the grandson. So a pretty successful day.
And Mohammed Ali, no doubt getting ready for this event tonight. Was that a big part of your day?
Not that much, because I gave that responsibility to you as MC, and Manar, who is actually our technical director also tonight. But the day went very quickly, honestly speaking. Another organization which we run is Helping ACT, and that means actually during this COVID lockdown, at least 3 to 4 families are to be just delivered food at their doorstep kind of thing. And plus, I went to Havelock House to just restock their pantry. So by the time I was back, it was almost close to 5:45. And then, we just started to prepare for the forum. Thanks, Adrienne.
Okay, well, I think it's time to get underway. Welcome everybody to Forum Australia's Zoom online forum. Tonight we're talking about COVID-19, its impact on Canberra's social fabric. How has COVID-19 and the response to it changed how we live and also how we interact socially? And how could the community be affected in the next few years? We've got a terrific lineup of panelists. And just letting you know that you can pose questions to the panelists using the Q&A tab, which you'll see there on Zoom. Ask questions for the panelists by clicking the Q&A button to ask a question. You can also have more casual conversations using the chat function. But just a reminder that we will have a Q&A at the end of the session. Let's first begin, though, with the President of Forum Australia, Mohammed Ali.
Thank you very much, Adrienne, and thank you very much to all of the speakers. You have certainly honored Forum Australia, and thanks to all attendees who are listening, and because the event is also being streamlined. Therefore, I reckon that there will be a lot more people in addition to those who have formally just sent their accepted our invitation. Just a background for our new listeners and wonderful speakers today, that Forum Australia was started some 15 years ago, and the idea was very simple, that yes, the decisions which actually affect our lives are made in the parliaments, both ACT government parliament, legislative assembly, and also up the hill, but then they affect us as general Australians or grassroots people. So the idea was to have your say, and that's with that basic idea we started that, and we are so proud that every year in the last 15 years we have done on average 3 forums a year, and almost all topics, including the problems with CALD communities, migrant issues, higher education in Australia, to name, and harmony has been very close to our heart, and that's how the things have been going. So I think that today is just a new chapter which has just opened up, because now we are talking on certainly very important issue, and I must thank all the speakers and our MC that you're doing a great job, and I welcome on behalf of Forum Australia to everyone who is listening, and back to you, Francis, Adrienne.
Thank you very much, Mohammed. Now let's hear from one of our panelists, Dr. Yonatan Dinku. He's an economist. He's also a research fellow at the Centre for Aboriginal Economic Policy Research at the ANU. Welcome to you, Dr. Dinku.
Thanks so much, Adrienne. May I share a screen? Hello, everyone. My name is Yonatan. I'm a research fellow at the ANU. And it's a pleasure to be here. And thank you for the organizers of the Forum Australia. Tonight, I'll be focusing on how young Canberrans are faring during this COVID and the public health emergencies that relate to COVID, and how they've been impacted by the different measures that have been taken by the public health system. And my focus would be on 3 key points: economic security, social connectedness, and I'll be speaking briefly about the consequence on mental health related issues. And to give you a little bit of background and why I am interested to focus on young people, of course, every one of us, if not all of us, have been impacted by the COVID pandemic, especially by lockdown and restrictions put in place. But not every one of us have been impacted equally. And one of the hardest hit demographic group, not only in Canberra, but across Australia and over the world, young people. And this is for different pre-existing reasons. In terms of employment, as well known, that young people in Canberra, specifically, which I'm talking about tonight, are having precarious labor market conditions compared to older Canberrans, in a sense that their employment is concentrated in casual employment, low-skill occupations, and they tend to work more likely in industries that are hard hit by the COVID restriction. So they're in casual employment and have low skills, means they are it's easier for employers to retrench and reduce them whenever there are constraints on the cash flow, and they're working in sectors like the retail and accommodation and food services, means when these industries are shut down or they reduce their operation, they are more likely to reduce young people. And young people are also more likely to live away from family members compared to older Canberrans, and they are more likely to report high level of distress and mental illness conditions that older Canberrans. And this is a pre-existing condition that, and this all data which you are seeing in front of this screen is a pre-COVID data. So young people are entering the COVID era with this pre-existing disadvantages as compared to their older cohort. So how would this implicate on their employment and social fabric connectedness, and as well as the psychological and emotional well-being. Just last week, the ABS released the COVID impacts or related impacts on payroll jobs, wage and unemployment around Australia, and specifically for the ACT. When we look at the data for the months to 11th of September, we can see that there has been a significant reduction in the number of jobs and reduction in wage that come from employment, and a corresponding increase in the number of Canberrans who have claimed for unemployment benefit. This includes job seeker allowance as well as youth allowance for young people aged 16 to 21. And as I just mentioned in the previous slide, young people are in a precarious labor market condition. They are in casual employment, low-skilled jobs, and in most affected industries means they are more likely to be part of this group. So even if you don't have any direct data to see how many young people have lost their job, it's easy to understand that we expect them to be disproportionately impacted by the lockdown. It's just happening recently and at this time as well. And related to this is the impact of this lockdown and restriction having on their social connectedness, relationship with friends and family. Some surveys from the past, actually last year when the lockdown was not that much long and extended as it is this year in Canberra and the ACT. Young people from Canberra report that the COVID lockdown has kept them away from families and friends. And one particular young Canberran said that the COVID lockdown prevented me from contacting friends. I wasn't able to spend as much time with my family and I felt disconnected. And this restriction has also prevented them from helping their family and actually from grieving adequately and sending and saying goodbye to their loved ones. And this same person reported that, well, the biggest thing would definitely be the passing of my great-grandfather, although he had lived a very long life. It was hard on everyone in my family as COVID made it impossible to hold an actual funeral. And the restricted travel means I never really got a good chance to say goodbye. So you can imagine how the lockdown and restriction put in place is impacting young people, not just economically, even socially, and just keeping them away from their social interactions. Given young people have been kept away from their friends and family, actually from work, colleagues, and as well as the schools, because of this lockdown has been impacting the schools and social networks around the school, means that disconnection has made them feel more stressed than ever before. And this specific Canberran male has reported that the COVID lockdown prevented me from, sorry, I think, I missed one of the slides. Anyway, these lockdowns put in place and the restrictions that followed has impacted a significant mental health problem on young people in Canberra. And one 22-year-old ANU student and another young Canberran have reported that the lockdown has not only caused mental distress to them, actually made it difficult for them to access mental health services around Canberra because there has been a heightened demand for such services. So even if they managed to call health service providers. They have been booked for months away to get the service. But of course, the COVID pandemic may not be necessarily all about challenges, and there could be some potential opportunities. And an interesting potential opportunity could be that because young people have been left alone on their own to deal with problems, whether it's economic stress or social stress, there is a perception that they may have developed some resilience, which would be important for them to navigate through challenges in the future. And this 11-year-old Canberran has reported to the Unity of Australia that it's like what we have learned and how we have learned to cope with will stay with us for the rest of our lives. And if this is true, and if this can be generally applied to the wider young people in Australia, I think we can consider that such lockdown restrictions and put in place have perhaps made young people more resilient. And then as a perhaps potential opportunity that the COVID lockdown has brought means young people are kept away from employment opportunities, means they perhaps they have shifted their focus more onto education and training and building their human capital and skills, perhaps would be more competent in job markets in the future. In conclusion, I would say young Canberrans are among the hardest hit by the COVID pandemic. And of course, not every young person in Canberra are equally impacted, and perhaps any negative impact of the pandemic onto them is likely to be more significant for young people who are already in socioeconomically disadvantaged position, from families with low income and from families having, dysfunctional relationship would be more likely to be impacted. Well, in terms of future directions and policies, maybe in the way forward to the recovery of COVID, we need to scale up, mental health services and their access to employment services for those who have lost their job and who are suffering from mental health as a result of the COVID. Of course, and perhaps maybe provide, greater job opportunity and security as well to young people, so that they would be staying connected to the labor market. There has to be also an effort towards increasing their engagement with education and training opportunities, so that they will be more competent and resilient in the future in terms of economic opportunities. And most importantly, young people need to be engaged with decision-making activities, and they need to have an agency and a say in shaping their future, not just be treated as passive agents, and where all the Canberrans or all the age cohorts making decision on behalf of them, and they just passively receiving whatever has been decided for them. Thank you very much, and that's for now, but I'm happy to take on questions if you've got any.
Thank you very much. That's Dr. Yonatan Dinku, an economist and also research fellow at the Centre for Aboriginal Economic Policy Research at the ANU. If you've just joined us, this is a Zoom online forum tonight looking at COVID-19's impact on Canberra's social fabric. My name's Adrienne Francis. Great to be with you. You can use the Q&A tab to put your questions to the panelists now, and we will come to those questions after we've heard from all the panelists. I'd like to welcome now Dr. Emma Campbell, who is the CEO of the ACT Council of Social Service, also known as ACTCOSS, to join us.
Thank you very much, Adrienne, and I'd just like to begin by acknowledging that we're on the lands of the Ngunnawal people, and I pay my respects to elders, past, present and emerging. Look, over the last 18 months, the COVID health and economic crisis has had a significant impact on low-income households in the ACT. and their ability to make ends meet. Employment, incomes, and the prices of essential goods and services have fluctuated over the course of the pandemic. And governments, both federal and territory, have provided some critical financial supports and legal protections that have helped reduce the impact of this crisis for many of the most vulnerable in our community. Some key support measures, such as the coronavirus supplement and JobKeeper, have now been phased out. Meanwhile, of course, the COVID-19 crisis is clearly not over. Our community and economic recovery is ongoing, and more Canberra households are experiencing poverty than before the pandemic. Far from having built back better, there are now more households with low incomes struggling to meet the rising cost of essential goods and services in our community. Before the COVID-19 pandemic, it was estimated that around 8.6% of the ACT population were living below the poverty line. The poverty rate for children between 0 and 14 years in the ACT was estimated to be even higher at around 11.2%. Quite shocking numbers for the richest jurisdiction in Australia. Unemployment and household reliance on income support payments are the major drivers of income poverty in Australia. During the first 6 months of the COVID-19 pandemic, the number of people in the ACT receiving income support while looking for work more than doubled over just 2 months, from 7,135 in March 2020 to 14,858 in May 2020, remaining above 14,000 through to September 2020. By June 2021, this figure had fallen again to 9,341, but it was still 30% higher than the pre-COVID level. During the period from the 27th of April 2020 to the 24th of September, there was a ray of light when the Australian government introduced the coronavirus supplement at a rate of $550 per fortnight. This effectively doubled the rate of job seeker, lifting it above the poverty line. It was estimated that alongside JobKeeper, which allowed people to continue in some low-paid employment, the $550 per fortnight coronavirus supplement saw the ACT's poverty rate drop to 5.2%, well below the pre-COVID poverty rate. So we had this paradoxical situation where during COVID, we actually saw an improvement in levels of poverty. However, by October 2020, JobSeeker had returned to below the poverty line as the coronavirus supplement was reduced to $250 per fortnight. And it was estimated that the poverty rate in the ACT subsequently increased to around 9%, representing an estimated 38,000 Canberrans, which is around where it sits today. The phasing out of the coronavirus supplement has seen the JobSeeker payment return to well below the poverty line, even with an increase to the base rate of $50 per fortnight from the 1st of April 2021. That ongoing $50 per fortnight increase, around $4 a day to the base rate, saw the JobSeeker payment increase in real terms for the first time in over 25 years. But this long overdue increase falls well short of what is needed to address both the poverty and cost of living gaps that have widened for over a quarter of a century. Over this time, the cost of essential goods and services has increased at a higher rate than for non-essential items. And this has a disproportionate impact on living costs for low-income households who spend a greater proportion of their income on essentials such as housing, food, health, education, and energy. And I think we should just take a moment to remember the many people who were on temporary visas who had no access to JobSeeker and federal income supports during this time. Over the last 5 years, Canberrans have seen the prices of several essential goods and services increase significantly and at rates above the overall CPI for Canberra and nationally. These include electricity, 27.7% increase, gas 26%, health 19%, education 18%, housing 16%, meat and seafood nearly 13%, fruit and veg 12%. Housing is the most significant expense for low-income households in the ACT. And Housing affordability is not only a fundamental cost of living issue, it's also a social justice and human rights issue. A chronic lack of affordable housing has led to a housing crisis in the ACT, with the ACT having the highest rents and the highest rate of rental stress among low-income private rental households of any jurisdiction in Australia. Without significant federal and territory government investment in social housing, the ACT's affordable housing crisis will continue to worsen, deepening and entrenching disadvantage and homelessness in our community. What can we do about this? Addressing poverty and cost of living for low-income households in the ACT requires significant commitment and coordinated action from the ACT government and Australian governments. Ensuring that all Canberrans have adequate incomes and affordable housing is fundamental to this. Our economy needs to provide people with secure employment and adequate wages, and when it fails to do so, we need a safety net that ensures people can still afford to live a healthy and dignified life by providing adequate income support, concessions, and emergency financial and material relief. As I said, I've highlighted the lack of affordable housing and how this remains the biggest challenge confronting people on low incomes in the Canberra community. Accessible, affordable, safe and secure housing provides the necessary foundation from which people can actively meet their social, physical and emotional needs. A key means to address Canberra's housing affordability crisis is to invest in social housing, public housing and community housing. There is currently a shortfall of 3,100 social housing dwellings in the ACT. Federal and territory government investment in social housing is essential to avoid deepening and entrenching rental stress and homelessness. On the 1st of April, the rate of job seeker and youth allowance and other related payments increased in real terms for the first time, as I've just mentioned. However, the cost of living gap has grown over the past quarter of a century, and the initial coronavirus supplement of $550 per fortnight raised payments above the poverty line for one of the first times in a very long period of time. This increase made it possible for job seeker households to cover the essential cost of goods and services. The subsequent reduction and withdrawal of this supplement has seen the number of Canberrans living in poverty to increase to an estimated 38,000, including approximately 9,000 children, well above the pre-COVID levels. ACTCOSS continues to call on the Australian government to fix our social security system for good so that it keeps people out of poverty. We welcome the ACT government support for this as a member of National Cabinet and calling on their own respective leaders of the parties to also call for an increase in the level of job seeker. In addition to incomes and houses, there are many other areas where the Australian and ACT governments can take action to address poverty and the increasing cost of living pressures faced by low-income households. This includes action to make essential goods and services such as health, education, food, energy, and childcare more affordable. It's ACTCOSS's role to advocate for those issues, and we will continue to do so that we can all realise our vision for Canberra as a just, safe, and sustainable community in which everyone has a fair share of resources and services. Thank you.
Thank you. That is Dr. Emma Campbell, CEO of the ACT Council of Social Service. If you just joined us, this is a Zoom online forum looking at COVID-19, its impact on Canberra's social fabric. My name's Adrienne Francis. Great to be with you tonight. We've also heard tonight from Dr. Yonatan Dinku, an economist and research fellow at ANU's Centre for Aboriginal Economic Policy Research. Just a reminder, if you're listening in and you've got a question that's popping into your mind, it's a good idea to use the Q&A button on the Zoom link to actually pose that question, and we'll try and get to that after we've heard from all the panelists. Let's now hear from Darlene Cox, Executive Director of the Healthcare Consumers Association.
Thanks very much, and thanks for the invitation. It's great to be here with you. Look, I acknowledge I'm on Ngunnawal land and pay my respects to elders past, present and the emerging leaders. Healthcare Consumers Association is a peak consumer advocacy organisation in the Canberra region on health matters. We advocate for consumer interests in healthcare. We're a community group made up of like-minded individuals, about 150 of us, and there's 30 organisations who also share an interest in high quality care and how it meets the needs of consumers, carers and our communities. and we're funded by the ACT government. One of the things we do is to train and support members of the community to become consumer representatives and provide consumer perspectives on healthcare. And currently we support around 50 consumer reps on over 100 committees. We also undertake research into consumer experience and expectations of healthcare. So for over 40 years, we've been a critical friend of government and provided consumer insights. And we've been doing that through COVID as well. Since March 2020, with the first wave of the pandemic, we've worked very closely with the health services and the ACT to develop a clinical response. Our organisation's committed to consumer empowerment. And for us, that means that people are in charge of their own health, of our own health. We're also very focused on the delivery of high quality, safe healthcare. And we want a system where consumers are actively involved in decision making about our care. We're supported to ask questions and get answers in a way we can understand and act on. And we've been applying this approach throughout COVID. And tonight I'm going to share a few reflections on that. I'm a member of a committee called the Clinical Health Emergency Coordination Centre. The committee provides advice to the Chief Health Officer regarding the clinical response to COVID. Its members are senior leaders of the public health system and doctors, hospital administrators. And my role there is on providing consumer input and also with liaison with NGO and community organisations. I spend my day talking about COVID. I spend my day talking to consumers and carers about their experience of COVID and to community organisations about their experiences of working with government to meet the needs of our communities. The pandemic for me has underscored the importance of thinking about our systems and processes in terms of people. It has to be people first. It's the people who deliver the care, the people who provide the testing and the vaccination, the contact tracers, the behind the scenes people who are working through the policy implications and legislation, the people who deliver medicines and equipment, collect the pathology samples, the pathologists themselves, and of course the people like you and I who are accessing healthcare and our family and friends. It's all about the people and communities. COVID's underscored the importance of the voice of experts in public policy in developing a response. And we've seen how dangerous misinformation is. Public health and infectious disease specialists, microbiologists, epidemiologists have all been at the forefront of the public policy debates. And in the ACT, we are so fortunate that we've had a government that has not fallen in to politicise the role of these incredibly important professionals. The direct and early engagement with specialist local community organisations in the development and rollout of the public health campaigns and messaging has been so important. The expertise that rests in the community members and the community organisations has been recognised and made the most of. I think it's been demonstrated in how the government's responded to the needs of multicultural communities and those who might be living with significant disadvantage. Who may live in crowded homes or have unstable housing, people who have low income and have lost work because of the lockdown, and people who have issues with addiction. We're very much focused on the needs of those people who are more likely to have poor outcomes if they get COVID-19. And I think we all have a part to play to ensure that no one's left behind. So the response in the social housing at Condamine Court in Turner and Ainslie villages really demonstrated the importance of working with community organisations who understand the challenges many of these people face. We need to hear the voices of community leaders and community members. We can't make assumptions about what people need. And we need to work with the community organisations that they trust and who can give them a voice. We need to challenge the judgment and the stigma that so many people face in accessing services. Organisations like CAMA, the Canberra Alliance for Harm Minimisation and Advocacy, has long been recognised in the public health area as an important organisation supporting people who use drugs. It's a peer support organisation, and it's made such a difference during this last outbreak in helping people feel safe and talk about their needs in a non-judgmental way. The Directions Health Service has also been amazing in providing drug and alcohol treatment and support for people who are experiencing significant challenges. And they've worked alongside the clinical staff from Canberra Health Services so well to provide healthcare to the tenants in different social housing complexes. Directions has also been really important to roll out vaccinations to tenants and also clients of homelessness services. Communication's been so important during the pandemic, and I think we probably all recognise that. We can't forget important issues for consumers like informed consent, the involvement of family and friends, and being able to engage in meaningful discussion and get our questions answered. These things are central to high quality care. And it includes the use of the telephone interpreter service and the translation of materials into community languages. The way we access healthcare has changed during the pandemic, without a doubt. We've seen an increase in the use of telehealth, and it's been an effective option to reduce the transmission of the virus of us all, crowding waiting rooms and breathing heavily in anxiety while we wait to see the clinicians. Digital health's been held out to us as a way to transform healthcare for years, and COVID has been wonderfully disruptive and helped us advance that. We can now phone our GP for a consultation, get an electronic prescription sent to a pharmacy of our choice, and they can even deliver it. And sure, there's a fee for that. Telehealth doesn't work for everyone, however, and it's not a replacement for face-to-face consultations, but it's really made a difference to a lot of people. Another way COVID's changed the experience of healthcare is with the introduction of visitor restrictions in health services. These restrictions are hard to deal with, but it's about keeping people safe. It's designed to prevent the spread of the virus and ensure that the safest possible environment for patients and for healthcare workers. We know that these policies are placing additional strain on staff, especially the nurses. It can also lead to unintended safety consequences for patients, as we might be more at risk of falls, not being able to eat our food, or there being a delayed sort of recognition of if we're deteriorating, which if we had our family and friends near us would be addressed. Close friends and family members of patients are such an important part of our healthcare team. They provide an additional layer of support for us. And there's patient safety monitors. They can act as our advocates when they're not able to do it, when we're not able to do it ourselves. So we've accepted the restrictions, but in return, we wanted assurance from the health services that we were able to involve family in bedside handover on a telephone or an iPad, that they were still part of discharge planning. They could join in for medical rounds to talk to doctors and those other really important interactions. I have to say this has not been as smooth as we need it to be, but it's tough, and I understand how complex and hard it is. It takes time and planning to involve family and friends in this way, and the staff are already under incredible pressure. Visitor restrictions have also exacerbated the inequities among patients and families who may not have the resources that many of us enjoy. Not everyone's had equal access to the technologies to connect virtually with their families. At Healthcare Consumers, we provide information sessions and workshops to consumers and community groups to build understanding of the health system. We call this health literacy. Health literacy is about people having the knowledge, skills, and confidence to find, understand, and use information, be active partners in our care, and navigate the complicated and fragmented system in the health and hospitals. Across our communities, our health literacy has increased during the pandemic. If you think about it, we've learned the language of the pandemic: flatten the curve, surge capacity, PPE, double dose, TTIQ, epidemiology, breakthrough infections, and I could go on. So there's so many terms we're now finding ourselves using in common conversation. And we're more attuned to health messages. At Healthcare Consumers, we've provided significant feedback to government on messaging for communities, the importance of plain language, minimising the use of technical terms and medical jargon. And by the way, next week's Drop the Jargon Day, a day for professionals across health, community services and local government to use plain language in their interactions. Many of us have changed our behaviour in the pandemic. We've maintained physical distance, we wash our hands properly, finally, as our mothers taught us, wear a mask, check the exposure locations and use the check-in app. Many of us have regularly tuned in to the press conferences and check social media for updates. But there's a need for us still to do a little bit more and understand about this disease. And I don't mean as clinicians, but to be able to actively manage our health and that of our families. We need to know what to look out for, what the symptoms are, when to get tested, when to isolate, when to call the GP, or to call the ambulance and go to hospital. Asking questions is a really important part of keeping yourself safe in our health system. And we've seen that people can deteriorate quickly with this disease. All right, so my final point. The power of evaluation and reflection is often undervalued. I think it's even more important in times of crisis like now. We need to take the time to think back on what's worked, what hasn't, what we can change to improve our individual and collective response to a situation. I encourage everyone to take a moment to think about what's been happening and about the changes we can make to ensure that people get the most equitable access to the healthcare and the social supports they need to keep them safe. The way we've mobilised and responded to a significant threat has been amazing. I can only hope we can start to apply the same focus to responding to climate change. Thank you.
And thank you very much there for Darlene Cox, Executive Director of the Healthcare Consumers Association. You're listening to a Zoom online forum exploring the impact of COVID-19 on Canberra's social fabric. It's great to see some of your questions coming through using the question and answer tab. Please keep them coming because we will be putting those questions to the panellists when they conclude their remarks. Let's now hear from Kathy Ragless, the CEO of Companion House. Welcome, Kathy.
Thank you so much. Hi, everyone. Nice to see you all talking about such an important thing, although, you know, in some ways I feel like we're still right in the midst of this crisis. I still sort of feel like a bit of a straw in the storm trying to respond. So let's get together again in 6 months or a year and see how we feel then. I'm Kathy and I'm the Director of Companion House, assisting survivors of torture and trauma. We work with people who've sought safety in Australia from torture, persecution and war. So essentially we're working with asylum seekers and people from a refugee background. And in starting to speak to you, I'd actually like to start with the thought that a pandemic like this sort of amplifies what's already there or lays bare things that already exist in our society. It's nice to see your cat, Emma. That's really lovely. And I think that that's what I've really seen over the course of the pandemic is things that we already knew as social factors were amplified or grew over the course of the pandemic. I mean, one important thing to start with actually is that people from a refugee background and asylum seekers are disproportionately represented in essential services. So if you're looking at aged care, childcare, medical professions, cleaners, guess who is at the forefront of that? It really is people from a refugee background and many asylum seekers too. And I would not like to have this conversation without recognising that contribution as being such an important part of what the pandemic has illustrated to us. Something that we already knew. We knew people were working in those industries. We knew that they were important workers, but the COVID-19 close downs and the contribution that people have made that just all the more obvious. And they're very proud to have been in the position to make that contribution. We did make a really lovely film about that. It's not lovely because we made it. It's lovely because of the people that are in it. And if you go to the Companion House's YouTube channel, you'll be able to see On the Front Lines, which actually predates the Delta wave. So it was made in early 2021, focused on 2020. But the people that are in that film have continued their roles over 2021 under lots of really difficult circumstances. The next thing to say about the way the COVID-19 pandemic has affected the people that we work with would have to focus on asylum seekers. And of course, if asylum seekers are not only highly represented in some of those caring professions, they're also highly represented in the service industries. So when you get close downs, people that are working in hospitality and in transport, for example, immediately lose work. And in the first COVID lockdown, they were not eligible for any Centrelink relief at all. In this second one, they have, of course, been eligible, some people, not everybody, but some people, for the disaster relief payments, which has been a big change. And I think I would like to recognise ACT government's response to the very real danger of quite a substantial group of people, so some hundreds of asylum seekers actually facing destitution as a result of losing work and not being involved in other safety nets, particularly in the first lockdown. There has been, it's not a lot of money, and we're only sort of avoiding primary homelessness and people not being able to eat. It's not sort of providing a sustainable lifestyle for people, but the funding that has been put up and that we apply for through the Office of Multicultural Affairs discretionary funds has really ensured that families are able to eat and to pay their rent over both the first lockdown in 2020 and this more recent one. Noting, of course, that marginalised people will often be participating in the cash economy or doing very, very casual work or unable to meet the sort of paperwork requirements of Centrelink's requirements under the disaster relief payments in the second lockdown. So that funding that has been put forward by OMA has really made a very profound difference to some of the most marginalised people in the community. And yeah, I mean, I'd be hard pressed to say that it's enough or that we've done as much for that group as we'd like to, but I remain very grateful to the Office of Multicultural Affairs and ACT government for being responsive to what was potentially a really devastating impact on some very vulnerable people. And that probably, for me, is one of the main themes of the pandemic, is the impact on asylum seekers and how they feel about that. We did in the first half of 2021 actually run a series of consultations with community groups about how they experience the pandemic. And of course, this is all pre-Delta, but all still relevant. And I thought, I don't want to take too much of your time, but perhaps you'd be interested in just hearing a few comments from those 6 groups. Would you enjoy that? Just to get a sense and a bit more of a direct voice of the people who are affected. And they were affected in quite different ways. So in that first 2020 experience, as Emma has already sort of touched upon, there was a group of people who were on Centrelink benefits who actually sort of came under less financial stress as a result of COVID supplementations. And thank goodness that was the case, because we really had a work cut out for us to support people. But there was still a lot of uncertainty for them, particularly for people who are really new into Australia. So this is a comment from somebody who had just arrived from El Salvador, and they said, "There was a fire at first and now there's a pandemic. We don't even know many people in Canberra and we feel so lonely. I'm really worried about people back home and how are we going to cope with this lockdown? I know Canberra's safer compared to other places, but we feel so confused about how to go ahead, how to make connections with other people, and what danger COVID-19 actually provides to us." When we met with Arabic-speaking groups, we had very similar sorts of comments. People were lonely and scared, and they were particularly worried for people at home who didn't have protection from COVID-19 in quite the same way they did. People from Burma, that was people from Iraq mainly, and Syria. People from Burma expressed many similar things. They were very worried about people in Burma. There's no help for them there. There's no help for people in the camps. People across those sort of permanent arrival communities were also worried about their young people and their teenagers. They were worried they wouldn't adhere to restrictions and they'd get in trouble. There were lots of cleaners and essential workers in that group who were worried about catching COVID-19. They really struggled. Some communities really struggled with everything being online, saying, Zoom is not easy. I can't get any service from anywhere without going online. It's so difficult, so difficult to learn. And my computer died. young people actually were the most optimistic of all the 6 groups that we worked with, which I don't know if I have the insight to explain why, but one reason that it seemed why was that they felt so lucky to be in Australia. They talked to their families a lot. Even if I'm feeling down, I go and talk to my brothers and annoy them. And they were also very linked in to the internet. So they continued to socialise. They weren't intimidated by online life. They continued to socialise with their friends. When I'm feeling down, I call friends and I connect to my friends and I can play games all day long. So young people were actually much more upbeat than many others. The groups that really expressed a much sort of a really profound level of suffering over the 2020 period were 2 other groups. That was asylum seekers, who I've already touched on, and also asylum seekers and refugees from an LGBTIQ background. And I want to flag that because I think it's really important. The LGBTIQ people tend to not have the support of communities, tend to not have the support of family, and tend to be much more profoundly socially isolated, which I hadn't understood because this is a very intelligent, often English-speaking group, and I hadn't understood how profound that sense of loneliness and isolation and risk was over the COVID-19 lockdown. So this relates to the first one, but is lockdown, but is relevant to the second one too. The majority of those LGBTIQ community participants told us that they had had violence and threats from people, especially flatmates in housing and others over the course of lockdown. They're very concerned about employment and losing jobs. One of them said, "I was so ashamed to ask for food." Another said, "I shut down. I didn't meet anyone. I just wanted to pass the day without ever having to feel that day had been." Asylum seekers similarly felt very frightened. And I mean, I guess that's because they are very marginalised and not part of mainstream sort of support in many cases. They also, all of the participants, and there were 20 participants in that group, said they were worried about becoming homeless. They said their accommodation was precarious, they had no money and were very anxious. And they said something really interesting, which was that nobody ever listens to our struggles, and nobody's ever asked us how we felt at any time. And they were very moved actually to be brought together. So there's a little bit of a taste of the experience of people over 2020. And I think they're all things that people experience. And once again, they were amplified over the COVID-19 period. We learned something different over 2021. And of course, we're a health organisation. So a lot of our, we've, endless vaccinations and primary healthcare. But one thing that, well, maybe other people knew this, so I'm talking about myself. What I learned was that many of the people we work with are just so highly exposed to a public health emergency. And when Delta first hit Canberra and we realised how exposed our communities were and how much they were really going to suffer from COVID-19, from catching it, I found that very sobering and very sad in some ways that I mean, I know all the theory about, who's exposed in a public health emergency, but this really played itself out. And the reason people are exposed is because they're doing, they have to keep working, and because they're in very communal communities, often with many people in one house. So in some communities, we have seen just very recently in the last few months, COVID-19 sweep through family by family by family in households of 10. And I remember writing many things to government in the last, well, probably 15 years, saying that overcrowded housing is a public health issue. And now I saw it really in action during the pandemic, because in houses of 10, it just went through house by house and every family member would catch it. So I just put that on the table, that housing is a really big problem in Canberra, but nothing amplified that more or laid that more bare than than this pandemic. And that's what they couldn't avoid that. They couldn't lock their 13 members of their house away from each other. There was no opportunity to do that. And I'm very glad that all of our community members thus far who have contracted COVID-19 have recovered. And that's a joyous thing, which we weren't sure whether would happen or not. People come back and they're better. Some people, of course, have had very profound health effects. Many have completely recovered, and we're early on in knowing exactly how that's going to play out over the long term. And I sincerely hope that everyone will have a full recovery over time. The other thing that, and this is my last point, I promise, the other thing that became really obvious to me was that there really are new opportunities for cooperation and collaboration and how we can work as a community. That why didn't we just do that before? And I think, I don't know if Nadia is still online, but we've had just a really wonderful kind of collaboration between a number of community organisations and the Office of Multicultural Affairs, which has been, something really quite startling that we never would have done before. We might have had some barriers and even some territorialism, God forbid. But the cooperation has just been very constructive. But even beyond that, I think that the Office of Multicultural Affairs has cooperated with some key communities and some community leaders in a way that we should have been doing all the time. And we kind of know that, but this gave us an opportunity and some bit of money flowing around to fund communities to do support to their own community members. And we're not talking about which communities have been particularly affected by COVID-19 for the obvious reasons that we don't want communities to suffer stigma or racism. But if we could, we would be doing a very big shout out to some of those community leaders who have been such public health heroes in our community over the last months. So there's my jumble of things I have to say. Thank you for listening, and for all the friends and partners, including Forum Australia, in helping ACT, Manar and Mohammed Ali. I think that the only way that we ever make community better is with our cooperation and collaboration, and our work and our respect for the communities with which we work.
Fantastic. It's been so wonderful to hear from all our panelists, and great to have 12 questions that have come in using the Q&A function while our panelists have been speaking. If you've got a burning question for the panelists, now is the time to write it into the Q&A tab so we can try and get it addressed in the next half hour of this panel on COVID and social fabric. My name is Adrienne Francis. Great to be with you tonight. Why don't we go to that lovely question that was sent in a little earlier using the Q&A tab. A really hopeful question. Have any of the speakers found a community hero in these COVID times able to inspire the rest of us into action? I'd love to hear from all the panelists on this. First, Yonatan. I'm not sure if, Yonatan, can you hear us?
Yeah, I have to be honest. In a very restricted situation that, and I haven't moved around. I don't have anyone to mention as a
No worries, Yonatan. Emma Campbell, have you been observing any particular community heroes that you feel might help inspire not just you but others into action?
Actually, Darlene did refer to one organisation, and that was an organisation called Karma, a tiny organisation, very small, that offers peer support to people who use drugs. And they went from being this relatively small organisation to really leading quite a lot of the response to those who have drug and alcohol issues, who were locked down as a result of outbreaks of COVID. So I would like to give a shout out to that community organisation, and it was quite extraordinary. Their advocacy, their passion, their commitment during those moments, particularly in Condamine Court, when it was right at the very beginning.
Great. Darlene, what about yourself? Have you got a community hero observation you'd like to share?
I think anyone who endured quarantine and was able to stay at home with their families and really keep the community safe. I'm thinking particularly the people in, say, Ainslie Village, who had rolling programs of quarantine because there constantly seemed to be new infections. I'm so thankful for so many people who have really taken one for the team in this. Yeah. Oh, you're on mute now, Adrienne.
My apologies. Kathy, would you like to nominate a community hero that has inspired you, but also the community that you serve?
There are too many, I must say. I'm going to say two things, actually. One is I would like to thank the leadership of ACT government for, and I hate to say the government's a hero, but maybe there have been heroic efforts, elements to the way from the Chief Minister down, ACT government has not demonised anyone publicly, has not racialised or demonised any person in the ACT. And I've been very moved by that and very proud to be a Canberran for that reason. So, you know, usually I'm advocating and lobbying politicians, but in this case, I would like to nominate them as having behaved in a very ethical fashion over the COVID-19 pandemic. There's so many others I could nominate, but as a hero, I'm going to give us patient zero in Canberra, which was Cedric, who is a much loved client of Companion House and copped a lot of hate online when he became the first known case in Canberra. Cedric is an extremely hardworking person. He did everything right. He checked in everywhere. He showed up and got tested, and he was very frightened and very sick. And he was an inspiration for many other African people. And so I'm going to put Cedric up as my hero for the pandemic.
I'm just going to mention a few that I've observed just quickly. A couple that we've been talking about on ABC, Nassim Hassan, Gary Malhotra, Helping Hands, Turbans for Change, and of course, so many of the community pantries doing incredible work at the suburban level. They're all ones that have blown me out of the water and really inspired me. Another question that's sort of related to this, how can Canberrans influence positive change in our social fabric through community effort rather than perhaps the government? Would anyone like to particularly talk to that? How can Canberrans influence positive change in social fabric? Emma?
Look, I mean, my job is in many ways to shape government policy to change some of the systems that lead to social injustice. But I think what's really important for community members is to think about things that don't necessarily impact them, but impact the broader community, and be active and I guess play a political role or vote on issues that, yeah, as I said, don't directly impact them, but are the things that make change in our community. For example, on issues of housing or on income support. But the other thing as well is to support local organisations. We have Hands Across Canberra, which is the major organisation that collects funds in the ACT for local ACT organisations who support people who face disadvantage. I think Canberrans are a very generous group, but often give to charities that help overseas or outside of the ACT and forget that we have poverty and disadvantage right on our doorstep. And I think recognising that this inequality is happening in Canberra think about that when you become politically active, and also to support local organisations is a great thing that you can do to support.
Darlene, would you like to add to that? How to influence positive change in the social fabric of Canberra?
Get involved. There are some amazing organisations that make a difference. So if you're interested in healthcare, come and join Healthcare Consumers. If you want to advocate for housing, go and check out Shelter. There are so many organisations, whether you want to do practical volunteering or get involved in governance and policy work, there's plenty of opportunities. But I think really it's about commitment, connection, collaboration, and recognising that we all have a responsibility to make sure everyone's okay, and that those that we're talking about it, we're mindful of it, educate ourselves about those issues. But ultimately, I think active citizenry is the best way.
Kathy, would you like to share your thoughts?
Yes. Firstly, I think that embracing the sort of leadership that we've seen, where we go forward in not accepting racist divisions or demonising of certain bits of the population, that we can go forward post-pandemic with that sense of being one community where every single person matters, is a very important concept, and I think has been well led by ACT government, as I've said. Secondly, to face the very stark reality that the pandemic lays bare, which is that there are some very poor people in our really very rich community, and that we need to really take a good, hard look at that from both policy and practical perspectives, and understand that within the influence of some of our local representatives are opportunities to take action to ensure, for example, that people are all housed, for example, and that in the future, these issues around housing stress and homelessness and living in poverty are not going to go away. They seem to be deepening, and we need to be demanding of our politicians and as ourselves, as community members, that we face up to that fairly and squarely and find answers to it, or we won't be able to be a harmonious community. That's what we would face in the long term.
Let's have a look at some of those questions now, really focusing on housing stress, because that came up in a number of the questions using the Q&A function. Just a reminder, if you've got a burning question, now's a really good time to put it in the Q&A box so that we can ask it of the panelists. This one from Tara Goodman came through. Housing stress is a common thread in many of the great talks we've had this evening. 3,100 is a huge shortfall. What are some of the creative approaches the community might take to help address this? Are there lessons from other states or other countries? Emma?
I mean, we have a solution right on our doorstep, and that is our not-for-profit community housing providers. These are charitable organisations who have projects ready to go. With the right support, they can deliver significant numbers of additional housing properties to people on low incomes. Now, there are complex economic and political reasons why there has not been yet more investment, but in our community housing providers. And we also really welcome investment in public housing, that is government-owned housing. But we see this as a really great opportunity. And when we talk about creativity, they are the perfect organizations to be creative, because they represent different communities, they work with different communities, they have different models, they've got experience of working in other jurisdictions as well that they can bring to the ACT, but land is just too expensive here. And that's why we need support from the ACT government to enable our community housing providers to deliver some of their innovative and exciting ideas.
Emma, can you flesh that out a little bit more, the right support? I'm thinking there about the community housing providers like YWCA, their Rent Well initiative. What would help fast track greater access to housing in that way?
Look, there's a lot of opportunities, but I think two really important things. So one is when a community housing provider does decide to build somewhere, that the community gets behind it. We have seen in many examples that the local community have not supported the development of social housing in their backyard, particularly community housing. And that's a real problem. So we have a call in the community for additional social housing, community housing, but when it's proposed in a local suburb, there's such passion against it. We've seen it in Common Ground in Dixon, and that is incredibly frustrating. And really, community housing that's run by not-for-profit organisations really manage their properties incredibly well. And it's a great opportunity to actually build community by having a social housing provider develop a number of homes in a suburb. So I think that's the first thing. We need to get community behind these ideas and work with local community councils and suburbs to explain why it's a good thing. The second thing is community housing providers can access money from the Commonwealth. They can even access private funding. But the problem in the ACT is that the land is too expensive to make the projects work. So the ACT government needs to be more creative, or needs to give more support so that our local community housing providers can develop projects in ways that are affordable. And that is just not happening at the moment. One other issue, we have a lot of church land that at the moment we can't build on, or our community housing can't build on because of planning laws. We're advocating to change those planning rules because many of our organisations who are related to churches are really willing to use this land to develop additional community housing facilities. So these are some ways that we can really unlock opportunities to develop more houses very quickly.
I might just stay with housing just for a little bit longer. Stella asked a question: what is the difference between social and public housing, and which one's easier to apply for in terms of paperwork and forms? Emma, can you help?
Sorry, and it's my fault, I often mix it up. So social housing is both public and community housing that is rented out generally at 25% of your income. Neither of them are particularly easy to access in the ACT. We have extremely long waiting lists for public housing, and you have income requirements for both. Affordable housing is housing that's either rented or sold at 75% of the market rate for that type of housing. So that might target a particular income group. So I hope that answers some of the queries.
And another housing question from Samaya. She says, post-lockdown, what does the government plan to do to enable the homeless to access affordable housing? It's a good question. What are you hearing, Emma?
Kathy may have some comments about this, because I'm sure she's supported many people who are experiencing homelessness or housing stress to find temporary accommodation. But I mean, this is a very good question. And I think, to be fair, the ACT government are deeply concerned about it too. But people cannot live in hotel accommodation with no end in sight. And we simply do not have homes to put families, individuals in when that temporary accommodation comes to an end.
Kathy, what would you like to say there on that?
Oh, I mean, I echo Emma's comments. I think we have certainly used donor funds to house people in hotels over the pandemic lockdowns when it's particularly difficult, where you can't stay with friends or couch surf or sleep at Woolies or outside Woolies or whatever. And we work very closely with housing providers and with lots of good friends at Housing ACT, but the stock is not there. They have worked very hard to try to respond the best they can, but it is very difficult without the bricks and mortar and the actual properties to draw upon. I mean, that's playing itself out at the moment, because we do We had a lot of new arrivals from interstate over 2020, but of course, a much slower flow of new arrival refugees and asylum seekers as a result of pandemic factors. But we have just had over 100 Afghan evacuees arrive in Canberra. And I think their housing situation is going to be very difficult over coming months. They are people who have family here and who are linked. But for them to find permanent and appropriate accommodation is going to be difficult. So yeah, I think these issues are just going to continue to bubble along, and they do cause a lot of distress to people.
Kathy, do you know anything more about how Red Cross is going with looking for permanent access to discounted rental properties for the Afghan evacuees in Canberra? They did put the call out a few weeks ago. Have any landlords come forward with properties?
Well, I think we'd have to pose that question to the Red Cross, but not enough, I think. There's going to need to be more. And I mean, this question about affordable housing really does actually prevent larger numbers of Australia's refugee intake coming to our jurisdiction, because there aren't the places to live.
If you're listening in and you've got a burning question, now's the time to put it in the Q&A box so that we can put it to the panellists. Thank you to all the panellists for being so generous with their time. Darlene, there was a question there around international students and whether any of the international students may have approached you at the Healthcare Consumers Network for assistance.
Not this time round. We did have some approaches last year. We have been talking with colleagues who look after the residences and certainly the ANU Students Association, but not the international students this time, which I was surprised by. Yep.
And there was also a question there about whether hospitals are able to, how can hospitals better care for cold patients with COVID? Is that among the conversations that you're having with that representative body that you told us about?
It's about the importance of using interpreters, that staff feel confident to use interpreters, and the patients actually have confidence that they will be used when they need to be. But there needs to be choice around that for them. So we're currently asking about, there's a COVID care at home program. So if you are diagnosed with COVID, and mostly you'll be treated in the community by COVID care at home nurses and checked in on regularly. And we've just asked the Canberra Health Services in the last few days about how is the interpreter service being used and offered in that forum, and what are we doing about providing community languages so that people are well supported, they understand what's happening to them, and they can ask their questions and get them answered. So it's a constant interpreter use, and community languages is a constant challenge.
Has access to interpreters been an issue at all, Darlene?
I think Kathy can probably speak to this better than I can.
Oh, sorry. Oh, well, yes. In fact, Canberra hasn't done particularly well with interpreter use in our public health systems over the last decade. There has been some very serious work from ACT Health to try to rectify that, but we've still got some way to catch up. And it is a really important issue. Having said that, and I would also like to thank the hospital staff and the staff in the ICU for the really excellent care that they have provided some of our clients. Yeah, much appreciated.
So Kathy, is there an issue of just not having enough trained interpreters that can be hired here in the ACT? What exactly is the problem?
No, I don't think that's the problem. At Companion House, for example, we have 1,500 patients, and we utilise the telephone interpreter service to work with our patients a lot of the time, which works well in a small jurisdiction because it also means that you've got a better chance of actually being private and confidential, and it won't be your cousin who's the interpreter. I think that it's about busy health professionals not having an easy way to get their interpreter quickly, and that those systems need to be well set up, because health professionals are really busy and very stretched a lot of the time. What they need is very ready access to their TISC code and a good speakerphone and a guideline that says that, that's what's expected of them.
Kathy, there was also a question around what more would you like the ACT government to do for asylum seekers and those on temporary visas at this time?
Well, I have some very concrete answers would be that we do need to expand in a small way the number of places that are available in the program for asylum seeker families without income, and to continue to be able to offer emergency financial relief and support to asylum seekers, and to continue the wonderful commitment to the ACT Asylum Seeker Access Card, which enables asylum seekers to get concessions and entitlements from ACT government services.
Sorry, I'm just unmuting. Kathy, there was also a detailed question around how could government officials better respond to the needs of recent migrants in the ACT as we move through post-lockdown, and sort of tied to that question, a suggestion that perhaps focusing on country of origin could be problematic for government officials. Your thoughts on that?
I'm sorry, I'm not sure that I understand the question. If someone would like to help me with what the question's asking.
I'll just try and ask it a little more clearly. So the question to me seemed to be, how could government officials better respond to the needs of recent migrants to the ACT as we move through post-lockdown developments? And then the person posing the question said, for example, people who have no interaction with Canberra's community services or with established means of communication. Does that help?
Yes, it helps a bit. I guess I don't know many people like that. Most people are pretty actively engaged with their community in one way or another, although sometimes suffering from sort of profound isolation, but still in contact with some connection points in the community. I think broadly speaking, the strategies are clearly to have translated materials, to be using interpreters, to be engaging with faith and community leaders, and community organisations, and to create a place of respect where people of diversity can maintain their dignity and feel that they are part of the community. I'm not sure if that answers the question, and if whoever answered it would like to ask to clarify what they needed to know, I'd be happy to say more.
Mohammed posed a question a little bit earlier, which is an interesting one to ponder on. Will life get back to normal after Australia has got all the required level of vaccinations? Why don't we hear from all the panelists on that one? Yonatan, would you like to share your thoughts? Will life get back to normal after Australia's got all the required level of vaccinations? A bit of a crystal ball.
Well, it's really tricky because life has different dimensions, and I don't know which one will be referring to. Yes and no. Yes, in essence, once vaccinations are fully rolled out, and let's say if all the expectations have been met in terms of 80% or whatever, 90% vaccination rates, within Australia or within Canberra, life will get back to normal, but that doesn't mean necessarily we'll be able to travel overseas, and especially while there is limited access to vaccine in developing nations, and in traveling around the world, it means there would be more risk to other people back home when you return to Australia. And in regards to employment, for example, I think for young people, it would be really challenging because this growing uncertainty, even after the lockdown, means people who have already employment and older generations would hang on their jobs, and because they don't want to face another insecurity in terms of income and related livelihoods. So it would be really challenging for young people to enter into the labor market as is to be pre-COVID. And that's why perhaps we need to prepare them in terms of providing them greater trainings and and support so that they would be more competitive in the future. Yeah, so yeah, it's that's me.
Darlene, what are your thoughts? Do you want a crystal ball?
Yeah, look, there's been some disruption that's actually been fabulous, and I don't want to go back in some ways. I want telehealth to continue to be an option for the consumers who it works for. I want people to have opportunities to work from home, to be able to better balance their caring responsibilities with their work responsibilities. I want to see this sort of the sense of connection with others fostered and continue to grow. There's also been increased health literacy, as I mentioned. You know, we just are so much more interested and aware of the health messaging. I don't want to lose that. I want to maintain that and foster it so that people become better at managing their health and feeling that they have a more sense of control over their lives.
Kind of linked to that question is another one. Apart from the deaths and illnesses sadly associated with COVID, including mental health challenges, could post-COVID be better socially than pre-COVID? Darlene?
Yeah, I think so. I think we can learn from what we've gone through. It's been, if you think about coming up 2 years, we had the fires, which was such a significant issue, very triggering for many who were here in 2003. Then we've gone straight into the first wave. We learnt, we regrouped, and now we've gone through Delta. Now we're certainly not through Delta, and there's still a lot of heavy lifting to do. But I feel quite hopeful in many ways, which is why I'm hoping we can then use that to mobilise and focus on climate change, which ultimately will be an even bigger threat to all of us.
Got time for one or two more questions, but if you've still got a burning one and you haven't submitted it on Q&A, please do so. Is there an opportunity to twin up with a family in COVID times? For example, existing English language home tutors. Kathy, have you got some thoughts on that? Twinning up with a family in COVID times to offer support?
Yes, it sounds like a lovely concept, and really sort of a bit on theme, as there is a big push in Australia to look at greater involvement of the community in the sponsorship and support of newly arrived people. I think maybe the pandemic context makes everything very complicated, because in lockdown you're actually seeking to prevent those sort of connections between people. And perhaps it's something that is really relevant to post-lockdown, that the community is more involved in supporting newly arrived people in particular. But yeah, that I'll think about the twinning of people over the COVID-19 period as well as something that we could think about.
I mentioned earlier, it was one of the community heroes that had inspired me, someone that I'd visited, Nazmul Hassan, who's offering a hot meal service, like a lot of other individuals in Canberra doing amazing things. Nazmul poses the question, do you think the government should change the funding model to allow individuals to be able to apply for grants to provide services during the pandemic or the disaster? Emma, what are your thoughts on that? We have seen so many individuals in Canberra trying to feed the community, trying to offer that vital support at the micro level in neighbourhoods. Do you have some thoughts on that?
Look, I think how we can get more people involved in supporting their local community is always something to discuss and contemplate. The challenge of the public health emergency is you need to ensure you're protecting the people who are serving and taking care of others. But we've seen amazing work from local communities where they've swapped their books, their libraries that they have outside their homes with food, and any ways that we can support those kinds of grassroots activities should be welcomed.
Darlene and Kathy, is that something you'd like to talk to? We have seen so many individuals using their personal funding to get these things going and then starting crowdfunding, but obviously it's hard. It's hard raising that money. It's hard continuing to get that money to provide that service. Does the funding model need to change?
I think from my perspective, it sort of has changed. Maybe not to the extent that would be good, but ACT government certainly has funded community leaders, for example, and communities through their ethnic community associations to respond to the pressures that are on their community. in quite a new and innovative way, which I think I referred to before. And I found that very encouraging. And I think for organisations like Helping ACT and probably others, there has been more opportunities for government support than there was before. And I think that, yes, that there is a big place for private donors in a public health emergency or any other kind of emergency. But we do need more flexibility from government as well. And that has certainly, from what I've seen, occurred to some extent or other.
And Darlene, did you want to say any last remarks there on that point?
I think at any time you've got a crisis of this proportion, you've got an opportunity to rethink things and test some assumptions, look for opportunities for new funding models. So as I said, evaluation and reflection is a really important activity for all of us to sort of engage in and think about how can we make it better.
And our last question, which has been repeated by both two different people posing questions here. What would be the right agency that could advocate on behalf of a mother with 3 little girls who've lost their father due to COVID-19 when he was on his way to Canberra? Can anyone help there in suggesting the right agency perhaps to advocate on behalf of the mum with the 3 little girls?
Was that in could I ask a question? Was that in a migration context or in what sort of?
I don't have that information here on the Q&A.
It sounds like a really sad circumstance and a horrible pandemic tragedy. Yeah. I don't know if Companion House are the right agency, but you would be welcome to ring me at Companion House and we'll work out who is.
Fantastic. All right. Well, look, I think it's now time to welcome Phillip Etches, the Executive Committee member from Forum Australia, to conclude tonight's Zoom online forum.
Thanks, Adrienne. Look, first of all, I'd just like to give a big thanks to the panelists who've managed to leave us feeling both more and slightly less optimistic. That's a rhetorical skill that not everybody has. And also with, I think, a basic question of whether and how we could do better by communities, regardless of COVID happening in the first place. There's a general sense I get from all of this that COVID hasn't really brought some problems up as much as it's laid bare existing problems. And as Emma noted, we haven't quite invested as much as necessary in things that might have helped. And the reasons for this seem to be rooted partly in policymaking and economic rationality, degree of NIMBYism, underpreparedness. Yonatan also noted that young people were already facing an insecure position, and that position was never very good to begin with. And the question I'm left with is something that I think echoes what Darlene said, which is whether disruption at this point might be positive. And again, I guess back to the point that Yonatan mentioned, youth are in an inherently awkward position due to their own place in life, but also their own place in the labor market and community generally. Emma noted that there's precarity also for the wider community that exists, and it seems to have been almost more circumstantial to some degree. Darlene, did point out that the spread of vulnerability is a bit wider, and it is across the wider community at the same time, as is the responsibility for responding to the problems that come up and that COVID brings out. And then, of course, Kathy pointed out to us that there are also more specific classes of persons facing economic vulnerabilities, asylum seekers in particular. There's a lot of closing rhetorical questions I'm left with that you probably shouldn't answer on camera, but I think the general picture isn't bad, but it is a little bit unsettling. And Kathy's later point suggests that we appear to have found a lot of problems rather than be confronted with them. And I'm not sure how we solve them. And Darlene's point obviously is that to some degree we're exposed, and that exposure appears to be a general problem that existed prior to this. And I think what I take away from all of this is that there's a long list of policy and process questions, and you'd have to review everything in here to even list them concisely, but the philosophical foundation appears to be that a general answer will come about when we start being a more compassionate community and compassionate government. I guess if nothing else, that's probably a positive thing. So I guess if there's a thing to be thankful to the panel for tonight, it's probably that.
Thank you so much, Phillip. Thank you for wrapping up tonight's wonderful evening, and thank you all to the panelists for their generous time this evening and putting up with the technology and flourishing on Zoom. So thank you so much to Kathy Ragless, CEO of Companion House, Dr. Yonatan Dinku, an economist and research fellow at the Centre for Aboriginal Economic Policy Research, Dr. Emma Campbell, CEO of the ACT Council of Social Service, Darlene Cox, Executive Director of the Healthcare Consumers Association, and also Phillip Etches, Executive Committee for Forum Australia, and also President Mohammed Ali. Thanks so much for your company this evening. Great conversation. And more information at Forum Australia online at the Facebook page where they've been streaming this conversation. Bye-bye.